General practice was in trouble before the pandemic. 6 years ago, Jeremy Hunt said we needed 5,000 more GPs. Up to 2020, when we should have had those 5,000 more GPs, we'd actually lost another 1,000 GPs. The job was so stressful, so challenging, so difficult, that it couldn't retain GPs and it couldn't encourage doctors to take it on as a profession. So it's another myth that GPs are taking lots of money and doing very little work. If you've got intelligent individuals qualifying as doctors that are shying away and staying away from what is actually one of the most challenging, one of the most difficult clinical positions, we need to ask ourselves what was going on to put them in that position. It's suffered from a lack of resource. It's suffered from additional work coming into general practice for many, many years. At the start of the pandemic, there were issues that were not really being addressed and nobody really knew the solution. As the pandemic came about, some GPs returned from retirement and almost every other GP upped their game and started increasing the hours they were working. Lots of the GPs that were nominally part-time, but for a part-time GP at 3 days a week doing 12 hours, they're actually working most other people's full-time, doing that 36 hours a week. The full-time GPs are genuinely doing 60 to 70 hours a week in their practices, slogging away to try and actually meet the demand that's coming through. As I say, everybody upped their game, everybody started doing more, and yet the workloads kept coming up and kept increasing. And as we're coming out of the pandemic, there's a bigger challenge because there's all that delayed, what we would call morbidity, but actually that's really just illness. That delayed illness, the people who've not had their secondary care treatment, who've deteriorated, who've got worse, and who need more input. And we've got to try and manage all of that as a system. General practice has to work with our partners in care. We've got to work with everybody else to try and make sure that people are getting as good a quality of life as they can. So those pressures, they tell on the whole of our team. And it is a team within general practice. It's a family within general practice. We see the staff we work with as being as close as family. And you can see that different people are starting to crack under the different strains. So we need to support them as much as we can. There's an issue that's another workload for each and every one of us to actually make sure we're looking at each other's backs. We fully appreciate that mental health deteriorated for almost everybody during COVID. When you're at home, if you're alone, and there's a lot of loneliness that came on during COVID because people couldn't go and look after each other in the way they had done previously. When you actually got that loneliness, it is only going to have a detrimental impact on your mental health. And we've seen the anxiety rise, particularly in some of the younger generation, as they've not had the ability to have that same peer support and interaction that they would have had in years gone by. So we know from our own staff and the impact that it's had on them and our own families, and we also know from the patients we look after, that stress, anxiety, pressure, and the deterioration in mental health is a huge impact for everybody. And what we need to do now is try and act as a society to make sure we're supporting each other as much as we can. And that again comes down to behaviours. We need to make sure that our behaviours are as supportive as they can be, and that we're not actually putting ourselves in a position of undermining or deteriorating or destroying anybody's confidence or well-being.